Hello, it's another episode of Let's Chat Health Tech, and this time it's going to be a solo episode. And I thought I'd use this opportunity to kind of wrap up the season a little bit with a couple of major thoughts and also what's going to be happening in the near future. So we've got some big things in store for the next season, and I'll explain that toward the end. But first, I'd like to kind of get into talking about healthcare and why healthcare sales is so hard and why that shouldn't be discouraging, but rather it should give you a certain sense of confidence. And the thing about healthcare sales these days, it's really a little different from other industries. And I've spent some time in telecom and a bunch of time in financial services and Wall Street and so forth. But there's something about healthcare that's just incredibly more complicated, just because of the nature of all the moving parts and the regulatory component and the kind of the consultative component and it's so consensus driven and huge. And all these things just contribute to make healthcare sales really, really challenging. And on top of that, so one of the things about healthcare sales that I've found is you can't just know how to sell anymore. It's not enough to know how the Miller-Heiman process or the Challenger process and just be able to execute. I think you really have to become much more of a consultant and a trusted advisor to your customers in a way that's really impactful, which is so it's not enough to just help them move things forward. You actually have to look at their business and be able to contribute to it in a meaningful way in terms of providing insight. And that contributes to a very long sales cycle, and it requires you to do a lot of learning. You have to know a lot about the industry from a kind of a detailed perspective. So and that requires you to do a lot of learning. But at the same time, I think that this is ultimately your moat. This is the opportunity that you have, or the upside that you have, because if you are one of those people that can get into the details and understand things and do the necessary work and the study, that is your moat. That is the thing that's going to differentiate you from everybody else, and it's going to make it more rewarding, because the sales efforts are hard, they're complex, they're long, they're challenging, but I think that also makes them rewarding, and it makes them fun. It makes them interesting. And this isn't a simple meet someone once, make a sale, provide a price, provide a quote, and you're done. It's none of that. There's just none of that in the healthcare world in any meaningful sense. I mean, if you're selling materials into, masks and whatever the things are that go on top of the examination table, then probably it's price and service. But if you're selling anything complicated, patient-facing, provider-facing sorts of solutions, things to health plans and so forth, there's a long sales cycles and a lot of people involved and a lot of consensus that goes into it in order to decision making. And at the same time, they're dealing with just so many different complexities in terms of regulatory stuff and new initiatives and existing systems, and invariably there's an epic upgrade or migration, which can throw a huge wrench into things. But in addition to that, there's all the other stuff that's going on. For example, there's the big, beautiful bill, right? And being able to understand that and explain that in meaningful ways and figure out how your solution might be able to contribute to that. For example, with hospitals, rural hospitals are going to get clobbered by this. And if they're relying heavily on Medicaid, and they invariably are if they're a rural hospital, they're going to struggle even more than they are now. And that's going to hit sometime after November. So being able to think about that in terms of meaningful ways as you represent what your solution is going to be really helpful to you. If you're in the risk adjustment space, on the payer side, and examining that and seeing what's happened there in terms of some of the penalties that have taken place and what happened with Medicare Advantage and some of the maneuvering that's been going on, that's something, if you can articulate what you do in terms of being able to help with risk adjustment and make it more defensible, that's going to be an advantage for you on the health plan side. AI is a disruptor. Is just going to be enormous. The things that are happening in terms of AI, there are dozens of different solutions in the revenue cycle management space that are coming out, and now health plans and health systems and hospitals are looking at those and going, which one do I pick? And how do I test it? And the confusion and just the sheer overwhelming paradox of choice is going to be a challenge. And so how do you differentiate yourself in that world? And what can you do to articulate? These are some of the things I'm doing on behalf of some of my customers, is kind of helping them to customize their message and communicate the value in ways that are really compelling. Prior auth is happening with the Office of the Inspector General and what they're doing around prior auth and seeing what's happening there. I mean, if you watch any of Eric Bricker's videos, you'll see that like the number of denials that take place, and then ultimately the number and how few are actually contested. But when they're contested, they're overwhelmingly approved, and so you're seeing a real crackdown in terms of the kind of prior auth and denial efforts that health plans are going through. So can you address that in some interesting way? And then the CMS Access program is another one, right, where there's chronic care opportunities. And so if you've got a patient facing provider facing solution as a health tech company, this might be a really interesting time to get in front of health plans or more importantly, providers, and see how you can contribute and take advantage of this program. So these are some of the things that I'm seeing in the healthcare space. So, I mean, if you're in health tech sales, selling into health plans and health systems, hospitals, large provider groups, and that sort of thing, it's just no longer enough to just know how process works and sell and, follow up and even triangulate if you're doing that. That's not enough anymore. You really have to be able to communicate and provide significant guidance and explain why your solution needs to be part of their immediate future and isn't something that they can put aside, until later. So that's something I wrestle with a lot in the newsletter that I send out, which will be in the comments below. So you can, if you want to join the newsletter and kind of get these sorts of specific tips, do so. And then what I like to do is kind of leave you with a quick sales tip. And I've got a procedure coming up, and so it coincides with the end of this season, and it reminds me of one of the great opportunities that you have as a health tech salesperson is pay attention to the situation in your own personal life where you're actively engaging in healthcare, and notice the process. Notice what goes on. Notice how you're involved in it, but also notice how everyone else around you is involved in it. The techs and the doctor and how they come in, and the wait times and what kind of surveys do they conduct, and because they have to deal with things like HEDIS and NCQA scores and quality metrics and so forth, and that is a function of how these the provider side of the equation operates. And ask some questions, find out what's going on. Like, be curious and use this as an opportunity to learn and collect an anecdote or two. One of my customers went out and went door to door and talked to physicians and walked into the office and asked. And it was surprising how effective that can be if you walk in, because unless you're a pharma rep or a device rep, you may not be doing that often. But in the early stages, to quote Paul Graham, you've got to do things that don't scale. And this is one of those instances where if you're in the patient-facing, provider-facing world, you've got a care management system, it probably makes sense to bump into the people in the office and talk to them directly and see what kind of information you can learn and maybe even get an opportunity out of it. So that's my kind of quick sales tip for the day. Just to wrap up, it's been a really good year so far for me. I've been really having a lot of great customers and across a real spectrum. And that's been one of the things that's really allowed me to kind of really learn a lot about the industry in a kind of a both comprehensively and also at a very detailed level, because I've got customers in the behavioral health space I've got customers in revenue cycle management and those that have got patient facing solutions and, even devices. I've been working with a couple of different companies that got devices that they're selling with. So I'm kind of end up being immersed in a lot of different areas. And I would encourage you to try and do the same. If you're selling health tech, it really helps to be able to have a comprehensive understanding of where the industry is going in total. And trust me when I say it's definitely going places. It's definitely going to be disrupted in very big ways because of AI and because of just the sheer cost structure and the fact that we're it's going to collapse under its own weight, social security and national debt. But healthcare is as an expense in the country is just enormous, and it's unsustainable. So definitely some things are going to happen. It's definitely going to be disrupted, and the health plan side of the industry in particular is going to see some real significant changes and upheaval. So look forward to that, and I'm spending some considerable time talking to people about that. The other thing I'd say is I've been doing a lot of work with Techstars. Their latest cohort just wrapped up, and it was just a tremendous experience, and also an opportunity to stay sharp in the space and see some really interesting companies and ideas that are definitely going to change things, and that's been really both inspiring and educational for me. And the same with TEDCO here in Baltimore. Really, that's been a great opportunity. I've had a chance to really establish a bunch of customers as friends, and then perhaps most important, I've added a member to the team. I'm not going to give anyone his name because I don't want him recruited away, but has been just a huge, huge impact in terms of my ability to be more productive and get things done. And so you can expect a bunch of new stuff happening in the next episodes, in the next season here. You know, real improvements. We've been producing a bunch of additional content. We've got a bunch of tools and resources that are now available. If you want to find out about those, ping me. And finally, just real quick, thank you so much for being here. If you're listening, I really appreciate it. It's fun to talk to you about these sorts of things. And I'll be bringing a bunch of new guests on and interviewing them about health tech and their perspective on health tech and where the industry is going. And so it should be a really good season coming up. And then, of course, if you have any questions for me, ping me. I answer them and love to get involved. And so with that, nice short session. Thanks for being here and, keep up the good work.